James Charles received an Indigenous scholarship from Australian Rotary Health in 2002. Completely illiterate at 14, he turned his life around and in 2004 graduated as a podiatrist. He completed his Masters and is currently undertaking a PhD at Newcastle University.
What I'm researching is Aboriginal foot health. We're looking at, obesity, diet, alcohol consumption, smoking, nerve function, blood flow. But it's really about, I suppose, in some ways, looking at a broad range of variables and then looking at what's important. When I was at uni, I think in my first year, I'm not really sure how I actually found out about it, but I think it was just on a list of some of the scholarships that you could get. And being myself, I had 4 young kids at that time, under 10 or even younger than that. I was doing quite well and I was really motivated, enthusiastic. I hadn't thought about any of these other things, but just to get through, to become a podiatrist. I went along to meet my local Rotary club, which was Adelaide East at the time, and they were fantastic. Ray Kidney was the president at the time. He said, look, we'd really like you to come and just do a bit of a presentation at the club, and I hadn't really ever spoken publicly before. In fact, I think that was my actual first presentation ever. Anyway, so I went along and I spoke, and that went really well, and then I got a Rotary scholarship, and that helped me to get through and become a podiatrist. And I also managed, luckily, through another great Rotarian, Jeff Bailey, who helped me to get the same support to do my Masters, which was very important for me, and particularly to do, say, the research that I wanted to do. After going out and working and seeing the issues that were there and that no one had investigated. And so then I got a scholarship to do my Masters as well. And that was a huge stepping stone for me to be able to do my PhD now and to do the research that I'm doing. I'm certainly very grateful and happy to give back in any way and that I can, in any little way. It's allowed me to help myself and my family and help my greater community, but also to serve as a bit of a mentor or set an example. So part of my giving back is to try to spread that and encourage. I work at the University of Newcastle, and a small part of my role is to try to mentor and help, and obviously I'm teaching as well, but that's in the teaching side of things. But then there's also the working with the communities. I wanted to be in the community with people and helping them, so it was a good choice for me. But to be able to help the Aboriginal community in that way, particularly, say, with podiatry, you're dealing with a lot of older people. I still see a lot of people that have never had a pair of shoes, things like that, that are limping around with a corn, not even knowing that someone could help them with that. And the pleasure to be able to help them, and then to see the relief that they have, and then walk out of the door feeling so much better and being so thankful, for me, it's amazing. It's really satisfying, and it makes going to work an enjoyable experience. Because I have to say that podiatry is not a glamorous profession, but it's definitely satisfying in that sense.